Could you please let us know a little bit about your career journey as a pharmacist?
Okay, well, I started from the Doctor of Pharmacy in 2017 and completed in 2022. Then I joined community pharmacy as a retail pharmacist or as a community pharmacist, we say. And I kept on going for almost 1 year and 4 months. That is my experience in retail and or community pharmacy. Where you can say both community pharmacy or retail pharmacy. We have same things here in Pakistan. So then I started my master's in pharmacology, and nowadays I'm pursuing my master's in pharmacology, and that's all.
Okay,
Well,
great. Do you want to add something else?
yeah, I want to add something. Well, in my graduation and my family career, I was the president of Pharmacy Student Society, where we tried to learn different things and to teach different things to our juniors and to make the environment of learning and what we could have done for pharmacy students. We tried our best and we learned also and we taught also.
And Dr. RAO, thank you for this nice introduction. Now, we would like to know how the pharmacists play the key role in the healthcare system in Pakistan as a medication specialist. Could you a little bit elucidate the role of the pharmacist in your healthcare system in Pakistan?
Well, the pharmacists actually have a lot of role in Pakistan, not only in healthcare system but also in industrial system, regulatory systems. But we will stick to the role in healthcare system. So first of all, pharmacist has a main role, which everyone knows, that dispensing of medicines. But not only dispensing is not only thing that pharmacists do. There is the monitoring of drugs that are controlled drugs, and also collaborating with the healthcare professionals. We also keep checking the effective and safe and effective use of medication, and we also do the compounding and preparation of customized medication in Pakistan. We used to do, but nowadays it is more allopathic system. So the science has and the inventions has come to it came to Pakistan. It has ended the compounding and preparing of customized medication. I recall that we were a child, the doctors or the pharmacists were there to prepare medication and compounding at the time of dispensing. So basically, in healthcare field, I think that pharmacists play a vital role, because not only in medication dispensing, because I have an internship in hospital pharmacy. We used to dispense medication and OPD. We used to do wards to check the drug interactions and safe are effective prescribed prescription. Basically, we used to check prescriptions, either is there any drug interaction or not. And also we used to we in Pakistan, in emergency pharmacy, we also collaborate with nurses, and in uh, overall the drugstore, we maintain the drugstores and check the warehouse, the inventory management. Basically, I can say inventory management is our job in Pakistan in hospital pharmacy. With healthcare system, I think mostly the pharmacist is linked to healthcare system in hospitals.
Well, wonderful. We really appreciate and we learn a lot the key role pharmacist is playing in the healthcare system in Pakistan. And one of the things you pointed during this first answer of this question is safety of medication safety. And you know, sometimes pharmacists interact with patients, but sometimes people ask themselves how pharmacist is doing to help to have safe and efficacy medication. Could you elaborate a little bit how you ensure that for your
Yes,
patient?
actually, whenever a physician writes a prescription, he don't tell the patient about its uses. He just gave him the prescription and ask him to take that drug from the medical store or pharmacy or OPD pharmacy or out pharmacy, a community or retail pharmacy. So basically, what we pharmacists do, we do patient counseling. We tell them how to use this drug, how many times, frequency of drug in uh, scientific language, I will say that what is the frequency of use and what will be the dose, and we have to check either the exact dose is being dispensed or not, and also we try to manage the use of controlled drugs. Controlled drugs are those drugs that have a very impact, or we will say the CNS drugs like alprazolam and diazepam, barbiturates. Basically, these are the controlled drugs, and we have to keep check and balance on these drugs. If we will dispense it without any prescription, it will, I think, will harm the community. So in this way, we try our best to safely and effectively use to make sure safe and effective use of drug by patient counseling. And we have omeprazole. We tell them that you have to take it in the morning without before eating anything, 30 minutes or 1 hour before eating anything. Or if there is any interaction, we check that interaction. Sometimes doctors are too busy in Pakistan because doctors physicians check almost 150 to 200 patients per day. That's why they sometimes they don't give their, I will say, don't give thought to drug interaction. That is our duty to check whether there is any drug interaction or not, whether the dose is okay with the age of patients. Sometimes they write two antibiotics, then in to same person, then we will try to consult with the doctor and ask them, is it okay to the patient for the patient to take double antibiotics? Like this, we try our test.
That's wonderful. That's great. I notice, for example, you are doing as a pharmacist. That's a normal role as a pharmacist, to check drug-to-drug
Yes,
interaction, and also doing different
yes,
other kind of, task. And some of them is like sometime is not very often, but it may happen. You can see, for example, a mistake or a dose error on the
yes,
prescription. So sometimes you need to
yes,
call back the physician or the nurse who did
yes,
this prescription. How this
yes.
collaboration work between pharmacists and other healthcare professional, physician, nurse, and other healthcare professional, how the interaction works in general.
Well, in Pakistan, there used to be a gap between the interaction. They first in start when the pharmacy profession introduced in the hospitals, the doctors you don't use to listen to the pharmacists. They used to say these are what kind of people, they will teach us that kind of thing. But in recent year, pharmacy profession in Pakistan has grown that there is a good interaction and good understanding between the pharmacists and physicians and nurses staff, nursing staff, because in every hospital, I will say, now even in every village there is a pharmacist for prescription dispensing of prescription. So we have come to that era when there was only the physician. Physician was like a god. Whatever they say is okay. Whatever they prescribe, and they didn't. There was no check and balance actually. So by introducing the profession of pharmacist in Pakistan, it was a very helpful and very vital the role of pharmacists. We are playing, and millions of pharmacists are playing here. And I'm quite enthusiastic about upcoming if there any issue. But for now, there is good interaction, good understanding between pharmacists and doctors and other healthcare professionals.
So that's wonderful. That means evolve this new role of the professional pharmacists. Pharmacists and other health care professionals are able to work together very well, and things is going very well as far I understand. Is that correct?
Yes.
Okay,
Yes.
that's wonderful. Now we know we are working on the healthcare, and in healthcare as in other scientific domain area, we have more and more new knowledge coming, and that means pharmacists and other healthcare professionals have to find a way to keep themselves up to date about the new drug and the new therapy. In Pakistan, how generally you organize yourself as a pharmacist to be able to stay up to date with the new drug and new medication?
Well, I would say it is the era of technology, and I would like to say that technology is the main reason or the main stream that keeps everyone up to date. Like in nowadays, if there any drug or any drug is being invented or any new drug has been coming into market, so internet is the best way. Social media is the best way to to conduct this knowledge or to pass this knowledge to everyone, especially healthcare professionals. And Pakistan, or I will say in the world, it is. I think the new research all over the world. There are going various research on almost each topic of the human body and each perspective, whatever it is. But there are gaps, there is research, but we can keep ourselves up to date with keeping ourselves in touch with social media and I say internet, because whenever there will be a book writing, the book will be written and then it will be printed and then it will come to market. It takes a lot of time. Rather than waiting for that, it is good to keep in touch with the internet. That is very fast way of communication.
Well, wonderful. So that means in Pakistan, like in other countries, people go more and more online to try to keep themselves up to date. Now, something we just want to clarify, we see in some country, like in Canada or in another country, is sometimes mandatory for pharmacists to do some training each year to be able to keep their license. Are there any rule in Pakistan on that, or people do that because they want themselves to keep themselves up to date, or it is mandatory for pharmacists to do some training each year?
Well, in our country, we call it internship. So we do it internship for our own goals, but it is not mandatory here in Pakistan to do training or anything else. But we do it. We have 5 years of our degree, and we start training almost every year, 2 to 3 months every year. We have vacations for those paper preparation basically, but we do preparation. Also, we try to do internship and training programs in different sectors like hospitals, like industries, like retail pharmacy, like distribution pharmacy.
Great, that's wonderful.
Almost every year.
And lastly, we would like to know your perspective about artificial intelligence. You know, everyone is talking about that, and people use that on the different fields, included in healthcare. Some people are seeing that as an opportunity for pharmacists. Other people are seeing as a threat. Some are even thinking about maybe artificial intelligence could replace the pharmacist. What is your perspective on that? And in general, how pharmacists are seeing artificial intelligence in Pakistan?
Okay. Basically, I would like to say that in Pakistan or in even the world, whenever there is a revolution, and it also hurts the labor. Basically. You see, when there was an industrial revolution all over the world, or in America, there were the labor that was hurt. That is a perspective we can see, but we are seeing, we are watching artificial intelligence, which basically I think it is a revolution in industry, IT industry, and I am looking forward to it for using at our own purpose. I recently wrote a basically small article, a one-page article on the self-medication. So basically, people those are frightened due to artificial intelligence. They are frightened because they think that people will start self-medication, etc. But there will always be a need of a professional. I think and artificial intelligence will be helpful for us to groom ourselves to uh, to keep pace with the world in Pakistan. In Pakistan, basically, we are not frightened of anything, but especially artificial intelligence. Don't think that it can replace pharmacists, because pharmacists have, it cannot prepare drugs, and it cannot. Then we can see the perspective of cost effectiveness. I don't think for in recent future of almost 10 to 20 years there will be a cost effectiveness in replacing artificial intelligence in the place of pharmacy. That is my perspective.
Great. Thank you so much for sharing your perspective. Dr. Rao, any closing word?
I would like to thank you, first of all, in my closing statement, that you provided me the chance to represent my country in front of you people. And I am very enthusiastic to keep in touch with you for the future, for the further any thing that I can help out to you with, or I can seek any help. I'm sure you will help me. That's all.